Come look at my nose. Maybe you can see it. Maybe you can see the splits in there. There should be clear looking tubing on each side. I'm not sure if you can see it or not.
Hey everybody, I'm Dana.
And I'm Corey.
And welcome. Today we actually have something special to share with you. One of us is having surgery.
Happy me.
So what I wanted to do is just take this time to talk a little bit to Corey about his surgery, pre-surgery. We're going to follow him through surgery, not in the operating room, but before and when he comes out. And then we're going to follow up with him after surgery to see what his overall thoughts of the process and the outcome of the surgery was. So first, Corey, I'd like to ask you a couple of questions. So first, can you tell us what type of surgery you're getting done?
I don't know the technical term of the surgery that I'm having, but I basically have a bilateral deviated septum, and then I also have some sinus issues in the front that they need to correct. There's some gray areas there that they need to clear up. And then I'm also getting tubes put in my ears, in both of my ears. I have fluid in my ears, and that comes back from a long history of having ear infections and things like that. Ever since I was little, I've always had breathing problems out my nose, just always getting sinus infections, just not being able to breathe properly. If I get a cold, like my cold is like twice as bad as someone else's. The doctor actually told me when he was looking at my CT scan and at the scope that they did through my nose is that it looks like the Nile River on both sides. And normally your septum is supposed to be completely straight, and it looks like that on both sides. So because of that, I'm not able to breathe. I also wear a CPAP machine, which goes over my nose, which means that if I have a cold or if I have some type of sinus infection, I can't breathe.
On a personal note, I just want to add, as your spouse, and having gone with you through this for the last, 14, 15 years, actually longer than that, almost 20, I know that when he gets sick, it is so much worse for him. What it's like to be somebody's spouse and want to be able to help them, or just friend and family member, want to be able to help them and not be able to do anything. He could tell you that I'm always like, maybe you just need to blow your nose, or and the little things that I come up with, but they haven't really been helpful. One of the interesting things is because I was there when he got one of his scopes, and so I was able to view, as the doctor did the scope, I could see the deviated septum. I mean, it was bad. Like, he could barely get the scope through the area. And I can't imagine what it's been like for you living like that. So after having this surgery, which we know is scheduled to take about an hour,
yeah.
And then you've got about a week that you get to recover from it. Mm-hmm. And from what we've heard, typically people are able to breathe better pretty quickly after it. Let me ask you, what is the very minimum you would want out of this surgery to consider it a success?
If I could breathe 50% better.
So 50% better?
I'd be good.
You'd be thinking it's successful. What about your hearing and the fluid?
That too. If I could get the fluid out and I not sound like I'm underwater, that would make me feel like it's successful.
Okay.
I don't have any pain or anything like that. It's really just being able to hear, clearly.
Okay.
Yeah.
So he's getting ready to go in surgery in about a week. So again, we'll go with him through the surgery, and then we're going to do a follow-up to see how things went. I'm so excited for him. I'm nervous, but I'm more excited than nervous. I have a strong faith system and belief system. I know he's going to be okay.
Yeah, I do too, but you just never know what might happen. So hopefully everything will be okay.
Keep Daddy,
Oh, dude, you could be careful. Thank you for my careful. It is probably close to 7 o'clock in the morning.
And I'm Dana.
She's driving. It's probably close to like 7 o'clock in the morning. I'm not really sure what time it is.
There's a clock right there.
Oh, is that clock right?
Yeah.
Okay, it's 6:37 in the morning. The morning of my surgery on Friday. I am going to have my septoplasty surgery done, and turbinate reduction and sinus reduction. So I just wanted to come on here and say hello. I am a little bit nervous, but I'm sure everything's gonna be fine because God has my hand. We'll see what I sound like. That's the important thing. Well, the important thing is to see how I breathe. Oh, and I'm also getting ear tubes. The important thing is to see how I breathe, but I'm interested to hear what I sound like as well, because I'm very nasal when I talk. So maybe that will change.
How you feeling?
Nervous. Not excited.
Lift your arms the other way, so I can see you have a band on it. You want some more water? I love you too.
Nice and sunny outside. Probably waiting to rain when I'm ready to go. What's that?
He said Glenn Burns said no rain today.
Glenn Burns? Well, I'm hoping Glenn Burns.
And do we have a little dog?
Yeah.
What's her name?
Pop-Tart.
Yes. I talked to your mommy.
You did?
She knows you're okay.
Okay.
You can read that?
It looks like it says football.
It does. It's talking about football practice tonight or something.
Oklahoma versus West Virginia.
Here, drink some more. Oops, let me put some more in there.
It's empty.
I know. I'm gonna get you some more.
Well, today is what?
Today is day 4.
Day 4. It's been slow going, but getting better every single day. I've been really, really tired because I haven't been able to sleep at night or even during the day because I can't use my CPAP mask. I'm also sore right here on the bridge on my mustache area, and my upper teeth are numb. My upper gums are numb, and they've been numb since Friday. And so I can't use my CPAP mask, so I can't really sleep that well. So I haven't really got any sleep in 4 days. I had a slight deviation from that surgery because my doctor told me that my adenoids were enlarged and they had to be removed. So during the middle of surgery, from what I was told from you, is that the nurse called you and said that he realized that my adenoids were enlarged and he needed to remove them and needed your permission to do so. My nose, I still have splints inside my nose. They're clear tubing, and so it's stopped up my nose and I can't breathe out of my nose right now. But it also adds pressure to my upper lip. This whole area is filled with pressure, and here, because of the splits and everything that's in there. I've been bleeding a lot. There's a lot of blood coming out, some mucus now. I had a mustache dressing on, which you probably seen in the video earlier when I came out of recovery. I've been using that every single day, but today and yesterday I stopped using it all day long. So it's like I just wipe whenever I have blood coming out. You might see some blood come out in a few minutes because it drips. When I came out of anesthesia, the pain level was kind of bad, like just sore. If somebody hits you in the nose really, really hard, that's the sore that you feel in your nose. But I've also had headaches, get really, really severe headaches in the back of my head and in the front, just all over.
So I can see your nose right now.
It's running?
Uh-huh.
Okay, hold on. But you can see, it's not, this is not too bad.
Is that all blood, or do you think it's mucus?
It's some mucus now. It used to be nothing but blood. The dressing when I was wearing it all the time, when I pulled it off, there were blood clots that were on the dressing. Really, really big blood clots. The very first day that we were home, I believe, I pulled the dressing off and there was a big blood clot. You pulled it out and it was horrible. I mean, one of the worst things I've ever seen. I wear the dressing at night. When I wake up in the morning and I pull it off, it's completely soaked with blood, and then there'll be some blood clots in it. But now it seems like it's more mucus than it is blood.
But you have been able to shower.
But I have been able to shower.
And
I don't shower above here.
Okay.
So I'll just wash my face with a washcloth, but I can't wash my hair. Also, I can brush my teeth. First couple days it was really hard for me to brush my teeth. And even now it's hard for me to brush my teeth because my teeth are really sensitive right here. I can't sneeze. I have to sneeze out of my mouth. I can't even really laugh, whatever, because it stretches those muscles. I can't breathe out of my nose. I couldn't breathe out of my nose before I had the surgery. The only results that I have right now is the ears. I can hear now. That's the only thing that I'm glad I did that, whatever. And I really just won't know until he pulls these out. If he pulls these things out and I can't smell anything, I'm going to be mad. And then I'll say, okay, I regret doing that. Or if it's worse pain when he pulls it out than it is right now on day 4, maybe I might have a minor regret. But I don't have any regrets.
What are the top 3 supplies you suggest people have in advance of getting this surgery for recovery purposes?
Tissues. Number 1, you need to have tissues because this won't stop. The neti pot, number 2, that really helps. And either hydrocodone or Tylenol for the headache.
I thought you were going to say mashed potatoes.
For the headaches. Oh, something soft to eat because you're going to be hungry. So like mashed potatoes, macaroni and cheese. My wife made me some mashed potatoes, the best mashed potatoes I ever had in my entire life. Those types of things, like if you had your tonsils taken out. But cold liquid, ice water, juice, it feels so good right here. My favorite thing, my wife went and got me because she loves me so much. She went to Dunkin' Donuts and she got me a frozen coffee, and it feels so good right here. Not only does it feel good, it tastes good too. I haven't been able to breathe out my nose.
Yeah, I can imagine. It's just one stitch, and I'm gonna give you a couple of Kleenex just to hold, just because some junk usually comes out with the splints.
All right.
A big pull here.
Oh yeah.
Oh my God, his thing is huge. I didn't know it was like that.
Let's get the other one out. I'm gonna clean that stuff up. You can gently wipe it if you want to.
Are they both out?
Yeah. This is all gel I put in there at the time of surgery.
It's been several weeks since I've had my surgery. I think that everything's going extremely well. I've had 2 post-op appointments and follow-ups since my surgery, and basically he just wanted to go in and clear everything out and just check and make sure that there was no mucus, no blood, no membrane, I guess, or anything like that that's up in my nose, just to make sure that everything was good. And so I feel really, really good since then. I can breathe out of my nose. I don't know if you can hear that, but I can breathe out of my nose, no problems. It used to be every time that I would breathe out of my nose, there would be some kind of or some kind of like mucus buildup or something that came out of my nose, and so I don't really have that anymore. That's the first time that I've had that in all my life that I can remember. I don't have to clear anything out in order for me to breathe. So I'm trying to force myself to breathe out of my nose normally every single day. instead of breathing out of my mouth. It's something that I have to just train myself to do. But I just wanted to let you know that I'm feeling really, really good about the surgery. I feel like it was worth it. I can't smell. That's the only thing, is I lost my sense of smell. It comes back every once in a while, but it's not really strong. So like I'll smell something for a second, and then all of a sudden I can't smell anymore like 20 minutes later. I've been told that comes back in a couple weeks or a couple months. I can hear really, really well. Like everything's really loud and clear. Like I don't have any problems with that since my ear tube's been put in. I can use my CPAP. I can get a good night's sleep. I'm still using my nasal spray and my sinus rinse, which has a steroid in it that they prescribe to me to make sure that everything in here just stays moist, because he doesn't want things to dry up, because if they do, then it'll create scabs, and those are really hard to get out. So I've got one more post-op appointment coming up for him to just go in with the scope and double check and make sure everything's good. He's probably going to suck out some more things and check any membranes and see if there's anything else going on in there. But other than that, I think I'm pretty clear. I think everything is really, really well. So that's the end of this vlog. I might put something else out a little bit later, like one more follow-up. But I want to thank you for coming along with on this journey with me. Thank you for following along. Hopefully this video is helpful to someone that may be having this procedure as well. If you have any questions about the procedure, any more details and stuff that you want to know, please leave it in the comments below. And don't forget to hit that subscribe button and the notification bell whenever you post new videos of any other things that we go on, we travel, we do. This was something that was a little bit special and different, and we hope that you enjoyed it. So just wanted to put that out there and let you guys know that I'm doing just great. Thanks for joining us.